Welcome to another episode of Judgment Date. We've been doing these programs for some while. I, in fact, had hoped not that long ago that perhaps we would move out of doing lockdown type programs to the reconstruction type programs, but alas, that's not entirely proved to be possible for all sorts of reasons. And to try to make some sense of what in fact is going on now, I'm absolutely delighted to introduce to you Professor Francois, Professor at the Faculty of Medicine at the University of Witwatersrand, and who really has been one of those voices who has essentially told truth to power. Francois, firstly, thank you. And secondly, well, let me ask you, this latest strain, what does that really mean for us? Or variant, whatever it is.
Firstly, yeah, whatever it is. I honestly, I think people are picking hairs. There's been a mutation and a lot of mutations actually in this virus, and a similar mutagenic way, but a very different virus in the UK at the same time. And it seems to have coincided with this massive surge of new cases. And it's very important. This is very preliminary data. So before we hand on the heart say we know what's going on here, it does look like this wave might be worse than the last one. It does look like it might be slightly different. There might be younger people involved. But all of that's subject to once getting some firmer data. And one of the explanations would be this new strain. Viruses mutate all the time, and this is not hardly big news. It's quite a large number of mutations. I work in HIV. We have every single virus that comes from the parent virus has at least one mutation. So that's a very mutagenic virus. This virus is somewhere in between. So 20 that we've seen at the moment in a relatively short space of time is quite worrying.
So what do we know about it? We know, for example, people who got the got COVID in the previous sort of way or mutation, do they still have the antibodies?
So they do have the antibodies, and we don't know for certain if those antibodies are going to stop you. Antibodies are not the only way you get immunity. There's a whole lot of other arcane immunological ways. Everybody, I think, has heard the term T-cell immunity, which is much, much harder to measure than antibodies. Antibodies, Tom, Dick, and Harry can prick their finger and pick up. But we do see with coronaviruses that people do get some sort of immunological resistance to getting it again going forward, but they have to. But that's temporary. It tends to wane with time. So what this actually means, this mutation, we're just trying to piece it together. What has been really specific about this virus, as well as the United Kingdom virus, which seems to have spread elsewhere, is it's displaced the one that was here 6 months ago. So now suddenly most infections are with this new kind. We don't know whether it's more dangerous, whether it's less dangerous, whether it's more infectious or not. The fact it's displaced it so quickly does suggest that there's something about it that's different from before.
And the fact that our numbers are going up, would you have expected that anyway? Because we were all expecting a second wave.
So I think that what you're seeing in other countries is this kind of 6-monthly wave. Countries like New Zealand and Iceland and a couple of the other, China even, they've almost artificially stopped the normal scale of the virus that we're seeing in South Africa. So what we're seeing are these 6-monthly peaks across the globe in countries which have managed to poorly control the virus, and we do see that with other viruses. You see it with pandemic flu, when it first hits us, it tends to go through these 6-monthly cycles. So we may be seeing that at the moment. I must say, just the waves of, and this is anecdote, but there's a lot of anecdotes. What I'm hearing from my doctor friends across the country is that things are much worse, and the patients tend to be younger. So that is quite scary, because traditionally it's been very much focused on the kind of risk groups we all come to understand, which is diabetics and old people. I just got back from the Eastern Cape, and the doctors told me that every single person who had died in the ICU there, at bar one in the last month, was diabetic, which is terrifying, because this country has a lot of diabetics in it. It's the second commonest cause of death prior to COVID. So there's lots of stuff here to be nervous and worried and anxious about, in the absence of hard data for us at the moment. And that's so frustrating, because I think everyone just wants a certainty around this that unfortunately isn't available.
So given that, are you then surprised that we're carrying on what might call a very relaxed mode of regulation?
Yes, I am. Yeah. No, I agree. I think that at this stage, you've heard me, we were chatting earlier, I've been quite critical of government. I think we all invest in government success. And one of my frustrations is that from day zero, prior to us having had a single case of COVID, the message was pretty much the same, which is physical distancing, hand washing, trying to get some sort of societal buy-in to wearing masks and things like that. And that was squandered because of some stupid policy decisions that undermined public trust. And unfortunately, that non-sexy stuff, which I think everyone is just tired of at the moment, is probably, if this wave is more severe, becomes even more important than it was the last time round. So yeah, I mean, I feel like I think it's possible to go on holiday safely, but I also think it's very possible to stay at home and be very unsafe. So rather getting the messaging around it, how do you do this properly? And one of the critical areas I think that's been lost is how much safer it is to be outdoors than it is to be indoors. Almost all the super spreading events, every major one that's been put out there has been from an indoor venue. So people to understand how much more dangerous it is to be indoors than it is to be outdoors, irrespective of the number of people and all the rest of it.
So let me ask you though, I mean, you're sitting, let me be quite honest, I'm sitting here, I'm a diabetic, although it's under control, but nonetheless, I don't want to take any chances. So I'm sitting here very apprehensively. Many people listening to you and myself, probably on the same position, are really very nervous. We look at other countries in the world and we say, they seem to be taking sort of really tough measures to lock down or to do something as a circuit breaker. All we do is close down a couple of beaches and just say, behave yourself. I mean, so, pardon me as an ignoramus on this, but I look at this and I say, well, why are they all doing this and why are we doing what we're doing?
I think there are more intelligent ways. I mean, I think, as I said, getting public buy-in. I was just struck walking through the airport yesterday, how many people had their masks off. That's the stuff that is going to make a difference. Banning the beaches, to my mind, we can discuss the possibilities. I think everyone's just got in their head this sort of Christmas Day of everyone packed on top of each other. Honestly, I think the beaches are probably the safest place on the planet at the moment in terms of it's got sunlight, it's got wind, it's got, you're hardly ever close to somebody for any length of time. And the wind is just going to blow the virus away. So to actually pick up, you're going to really be unlucky to pick it up with the virus. The mall, on the other hand, especially in a restaurant, is going to be much, much more of an issue.
So Francois, for example, carry on. Please carry on. Sorry, interrupt.
No, I agree with you. That's the stuff I would have focused on, is the indoor congregating stuff. And we've, as scientists, we've been quite, I think, remiss in trying to push that hard enough. But I also think government messaging should have been clearer about this. Tell the restaurant, no restaurant owner, no taxi driver has investment in their clientele getting COVID, their staff getting COVID. So why not? This is what we expect from you. This is how many people you can put in so many square meters. This is how much we expect you to open the windows. We expect you to put fans on. Those kind of practical things is how we should have framed it. Now, some people just got it and they did practically well, but others, just haven't been told that. And we as the walk should be able to walk into a restaurant and say, you're taking us seriously and you're taking our health seriously and your staff's health seriously. That's where they should have brought it in, rather than this draconian levels of which don't actually have practical content to them. Sorry, I cut you off.
No. You people are interested in you, not me. The point I wanted to ask was, when I've interviewed your colleague Shabir Mahdi, we've spoken about this. I mean, he too, as I understand, you were not particularly happy about what might be called a level 5 lockdown, etc. But he has said, when I've pushed him, he said, well, things like pubs and clubs, that's a different matter.
I agree.
These are terrible spreaders, and if you're going to close anything down, you might as well close them down rather than beaches. Would you agree with that?
I would agree with it. I would prefer to have a situation where you get social buy-in. People are going to congregate irrespective. And I was driving through a fairly rural area, and there are people sitting, in right in front of each other, indoors, drinking beer. What should be happening is a communication program around that. However, if you were going to use the sort of krachtdadigheid, securocrats of things, I would use the police just simply to go around to people and say, listen, this is not cool. You're just getting too close to each other. Just separate a little bit. And you could do that at the beaches. You could do that in pubs. You could do that in bars. But also just tell people, as I said, bar owners don't want their clientele to get infected. So tell them, open up the windows. My little dippy little gym went and I just had to go and explain to them some of the air movement things. So they were able to, I said, put up the fans, open the windows, where you can bash open walls, let the wind come through. At least South Africa's got a reasonable climate. We're not Europe, which is covered in snow at the moment, increasingly covered in snow, where closing the window, opening the windows is actually not an option. So we should be using those natural resources.
So let me then just ask you again from a point, again, of ignorance, but if you looked at, for example, all over Europe and beyond, they're taking a much more, if you wish, krachdagisch attitude, to take your point, in the sense that they're not trusting the fact that people are going to behave. And we're pretty notoriously bad about that anyway. I mean, so the question is there at a particular point where this thing is beginning to run away with itself? Or maybe it's too late now, I don't know, in relation to stricter regulation?
My fear is it might be too late this wave. My worry is that we're going to have another wave in 6 months, and 6 months after that, and 6 months after that. And, with the delays in vaccine procurement and the fact that I don't have a huge amount of trust that government has a coherent plan yet for vaccine procurement. Also, we're going to be competing against the entire world. So you're sitting there wanting to get out from behind closed doors with a safe vaccine in your arm. I'm on a vaccine trial, so I actually have, I think that, I have a 50-50 chance of having that vaccine in my arm to try and get back to normal life. But if we don't get that vaccine, and if that vaccine doesn't confer immunity for a substantial amount of time, and we might have to be giving it, my worst nightmare is giving it every year, like the flu vaccine. The whole country is going to have to get vaccinated every year. That's not going to happen next year or the year after. And then we're going to have to have a country that is attuned to these 6 monthly waves of infection. And if it does happen like that, the sad thing is, in a year's time, we're going to be having exactly the same conversation about beaches, about Christmas Day, and about New Year's Eve. And it's trying to get our society to understand that we might need some sort of social engineering that moves our holidays even. I mean, it sounds absolutely insane, but when you look at the scale of the death rates that we're seeing, particularly along the Garden Route and in the Eastern Cape and in Cape Town at the moment, and what we're seeing the slow uptake here in Johannesburg, I honestly think it's worth starting to have those discussions now, anticipating that we're not going to have a seamless transition to a vaccine society.
But let me ask about the vaccine. I read, for example, today from the Science Collective. I think you might have written some stuff there as well.
Yeah, no, it's on that paper.
Yeah. So there's the paper which I read today, and it sort of says to me, which is not dissimilar from what your colleagues Gray and Mardy have told me in previous interviews, that actually we're really behind the curve here. I mean,
yeah.
And that's very worrying.
So yes, if we are on the curve, or if we're ahead of the curve, government's not telling us. And I think my frustration through a lot of the last year has been just the lack of government's ability to communicate its decisions. And some of them really have not made sense. And from a scientific perspective, I mean, the one I think that is the easiest one to dispute is the tobacco ban. It's impossible to defend. It was, in fact, impossible to defend any which way you sliced it. And because they didn't do that, they undermined public trust. And we need that public trust desperately. So why are they not? So I came from the HIV advocacy world. If we had left ARV access to government, we would still be offering like 2 kisses and a prayer to every HIV positive person rather than actually antiretrovirals. And this is my frustration at the moment, is we're invested in them getting the vaccine. We need them to be successful. They might need our advocacy voices, our scientific voices. They may need us to scream and shout and throw, blood on paintings of pharma executives, if that's what's required to get us the vaccine. But simply standing up and saying, trust us, we've got this, when they couldn't even get the payment for the COVAX facility on time, is not going to cut it. So we need details. Yeah, we need details, and they need to take us into their confidence.
So when people read, for example, on the weekend press that the COVAX facility may give us, 3% of the population, 1.8 million. I mean, that for a hell of a lot of people just put them into paroxysms of despair.
Absolutely. Like 3% is not going to cut it. When you talk about herd immunity, a friend of mine made this really cynical comment. He said, well, that's great because it's going to take us 6 waves to get to herd immunity at this rate, because if that's the vaccine system. So 3%, you're going to battle to get onto it. As you said, there's a diabetic and there's somebody who's got comorbidities saying that you're going to battle to get into the front of the queue when you are probably one of the highest risk people. They're going to start with the healthcare workers. And again, we're going to have a discussion. It's like, what's a frontliner? It's all very well to say, these brave healthcare workers. And honestly, I have tremendous admiration for them because I haven't been looking after COVID patients. These frontliners really deserve everything. But there are a lot of frontliners. There's the police force. There's, the waiter who's serving you in your restaurant with the mask on.
Absolutely.
So who do we put at the front of that? So those debates we need to be talking about who is going to be. 3% to my mind sounds anemic. We need to be looking at far higher numbers than that.
So how does a country like South Africa then do that? I mean, if you were running the show, what would you do now?
I would definitely not be putting all my eggs in one basket in the COVAX facility. That would just be one. I would be going to the manufacturers. I would be screaming blue murder. I'd be asking our own local manufacturers, how quickly can you get this up and going? I must say, setting up a vaccine factory is a massive endeavor. It takes years and billions of rands to actually get the thing going. But we all invested in this. Like, put all your brightest minds and say, if money wasn't an option, what could we do and how quickly could we do it? At the moment, the Americans and the Brits are busy vaccinating huge chunks of their population this week. And we're told vaguely that there might be a 3% chance of us getting the vaccine in 6 months' time. It's like, why? Why should we be standing in the back of the queue? And I think that those debates and things, we should be talking to the manufacturers at the very least and saying, can we bypass the procurement systems? Is there some way of us getting that?
Can I ask you on that? I mean, how would you distribute the vaccine? I mean, is it possible, for example, every year I go off to Clicks and I get my flu shot. I mean, they seem to do it quite efficiently.
Absolutely. Like, we've got such amazing infrastructure for people to actually get that stuff done. If we leave it up to the clinics and so there's some practicalities. I think everyone's heard about the Pfizer vaccine that needs these sort of industrial level refrigeration. And sadly, that level of refrigeration is really only found in kind of Shabir and Glenda's labs, these kind of high tech labs. And, everyone's then going to have to travel to the labs to get the thing there. These refrigerators they're not minor affairs. We have to import them and make them available. We could get, certainly urban populations could get vaccinated centrally there. But hopefully these others, some of them are just in a normal cold chain. But even that's a big deal. In a country where the electricity keeps breaking down is a real problem. But the pharmacies are an absolutely amazing place to go. I've been working with them more and more closely, and I'm amazed. They follow the regulations. Everything is refrigerated to the nth degree. They chart everything. So that certainly is one of the places that I think is a great place. And Glenda was saying to me, just go to the grants queues and the places where people collect their pensions and just wait there, because those are the people who are going to desperately need it.
But so let me ask you then, I mean, from your perspective at this point, what are we talking about? Are we actually if this vaccine is going to take a hell of a long time, on your line of argument, we could be going through this wave and another one before we are in South Africa.
Absolutely. And if we don't start planning for that, worst case scenario, we don't get the vaccine. We don't start planning for that. And then second is that simply getting the vaccine into the country. I was listening to this amazing podcast. It's actually in the advisory that you were quoting earlier. Just talking about how many airplanes we need to transport. We're talking, no country in the world has vaccinated its entire adult population. South African childhood vaccine program is actually very, very good. But we are talking about something, I was part of the ARV program and designing it and helping it get up and implementing it. I honestly think this might be harder than that. The government needs to start thinking about this. The resources that are required, the planning, the logistics, the supply lines. The science is like this much of the project, the kind of scale of what we aim to do. And God help us if we have to do it every 2 or 3 years, because then we have to have, as you say, everyone's have to walk into the pharmacy.
But does the government talk to you people? I mean, you, the scientists, to know what you're talking about.
So there is this MAC vaccine advisory, which has got some good people on, but it doesn't have Shabir and Glenda, who are two of the most internationally renowned.
Yeah, I find that extraordinary.
I also just
we got and we don't have them there. I mean, that's yeah.
No, it smacks of political manipulation and control and stuff. And there's some really good people on that. Make no mistake on that MAC advisory. But again, we haven't seen any of publicly. We haven't seen any of their deliberations. We're just given these very vague statements that, the MAC advisories told us to be part of COVAX. What was the discussion? What were they considering? What are the terms? And a lot of that stuff is just not transparent. So we need everyone to, and honestly, people like me are going to be actually quite superfluous to all of this. It's going to be the kind of people who do Coca-Cola, like, and to get them into the most rural areas, who are going to be, we're going to need to pick their brains and say, how are we going to do this? How are we going to vaccinate the entire country in the same way you get Coke to every single person?
But so, practically speaking, if I mean, what sort of, we're not going to, as you say, it's impossible to conceive of vaccinating the entire population by the end of 21. But what sort of percentage would start making a significant dent on this?
So, I think that we're very clear on who is at risk. It's really clear that it's diabetics that are taking a hammering, older people. So you can start in the old age homes. You can kind of have age, and you can just stand at the diabetic clinics. But even that is a challenge, because much of diabetic care happens in primary care, and we're going to have to then have this vaccine then transported there. Frontline healthcare workers, really the frontline, the kind of ICU people and the people in the casualties, and the nurses and doctors and porters, those people I would certainly prioritize. But the society then needs to start having that discussion, and I think we talked about it in the advisory, is who do we exclude? Who do we not vaccinate initially? Who do we push to the front of the queue? And in this country, one of the interesting things I'm always asking people is like, so what about the foreigners in our borders? Like, are we going to exclude them? This is an infectious disease. Excluding anyone, if you're using vaccines to control the epidemic like we do with TB treatment or ARV treatment, excluding anyone who's within your borders is a difficult thing. So there's a really interesting ethical and other debates to be had in terms of this. So what do we do about people who refuse to be vaccinated? Do we allow them to get on airplanes? Do we allow them to go to restaurants? Do we allow them to, how much personal autonomy do people have in the wave of a pandemic that's fundamentally altering our society? And those debates we can have today. We don't need to wait till the vaccine's on top of us.
But it is interesting, just reading the British press, that their experts are saying, we've got to have this lockdown, and we've got to slow it down because help is coming. We've already vaccinated 500,000 people. And if we can flatten the curve for another 2 or 3 months, we could get through this. We're in an entirely different position, because if I listen to you, we haven't vaccinated, well, right, we haven't vaccinated anybody yet. So goodness knows where we've been to their argument.
And if this new variant, the doomsayers, the worst case scenario is that this new variant's like flu, where there's no crossover immunity pretty much from season to season. So that's not totally true. With flu, there is some crossover immunity, but it fades. And within 5 years, what protected you 5 years ago isn't going to protect you now. So there is a lot to be said for starting to think about, if it does look like it's having 2-month periods where the country needs to start thinking about where it's going to be extra careful in terms of physical distancing, where maybe the bars do close, where the levels of limitations on taxi containment is settled. So having these sort of very grown-up, difficult conversations with a lot of unknowns and uncertainty, and understanding that things might change in the next month, needs to happen. So I think throwing all our eggs in the same and waiting for the vaccine, if the vaccine only works annually, how is Britain going to handle that? If that's all that they're going for. So we're doing studies on using drugs to stop people getting it. We're also giving people drugs that might be, we're testing these drugs to try and see if we give it to them in the early parts of infection, can they stop infecting their families? So those are other things. They sort of left field stuff that we're throwing our book at. But the bottom line is, all of the stuff might not work. In which case, 6 months' time, in a year's time, we're going to be sitting here discussing Christmas beaches. We better have a better plan than the one that's on the table at the moment, which is simply, a free-for-all, and we close the garden route, which honestly, as you pointed out, is firstly only going to affect a tiny number of people, and secondly, it doesn't address the fundamental problem, which is people congregating.
So can I just ask you, let me come back to that. Let me ask one final question on this, and then I wanted to ask you about the treatments. But when one listens, for example, on Friday, when there was big announcement and Professor Karim spoke, and I think Professor de Oliveira, not that I understood a word that he was saying, but I did understand what Professor Karim was saying. I think you had to be a doctor to understand what the hell he was talking about. But obviously it sounded very smart. When you listen to all of that, and now you're being told by these experts, this could well be a more speedy transmission, extensive transmission of the disease. If you're sitting there as an ordinary person, you think, well, if it's going to be quicker, be transmissible, and you're telling us it's going up almost in a vertical shape, then what are you doing about it? And I heard, as an ordinary person, I'm sure everyone listening, nothing which told me other than don't panic.
Yeah, which is a recipe for panicking. There's no
yes,
better way.
exactly.
I
So
remember one of the Dustin Hoffman article, which is try to remain calm, and it's like, oh my God, that's the best, best way to panic.
So the question I suppose I'm asking you is, there seems to be a sort of dissonance between telling us that we're in a situation where the wave may be more extensive and it may infect more people, but nothing more. Now, that's what's really freaking people like myself out.
So my advice to my family, which is probably, so my father's in his 70s, I've got an uncle who's also in his 70s and he's quite frail, is stay behind closed doors. At the very least for the next month or so. While the surge is happening, this is not the time to go and meet your chummies. It's not the time to go and play bowls. It's not the time to get on airplane. Just stay behind closed doors. That doesn't mean social isolation. Thank God for Skype and Zoom and everything else that allows us to at least connect. There are ways to make it safe, and we put out a holiday collective where we said, just plan better. So the weakest link here is, unfortunately, in many cases, probably children. The children play with each other. They probably they come home, and that's when granny and grandpa are probably going to get infected. And to try and think about that, if the kids are going to be playing together, one of the most heartrending questions I got from one of my friend's mothers said, I haven't hugged my grandchildren in a year. How can I do it safely? And like, you can, you just need it carefully explained, and I said to her, like, listen, just make sure that you hug the children, you have your mask, everybody washes their hands, you hug them, and then you go leave them and you go and wash your hands again. You can chat to them over the fence, you can chat to them over the table, in fact, and be safe. But that kind of level of counseling is probably what is going to make it human. There's so many cases of Deborah Birx, the ambassador, the head of the coronavirus thing for the US, just got caught going to Thanksgiving with her grandchildren, and everyone's laying into her, and she was very hypocritical about doing that. But I kind of think we all relate to that, is we all want that human contact as much as possible. And there are ways to do it safely, but it has to be thoughtful. Simply saying don't go away on holiday is firstly not the only way to, you're going to be at risk. Simply staying in Joburg and going to the mall, you can be putting yourself at huge risk, or going to a family gathering.
So let me then just ask you, so I'm running out of time, are we doing better with treatments?
So yes, is the short answer. Certainly the death rates in the ICUs have gone down quite a lot, by almost 2/3. And that's thanks to new areas, understandings of how oxygenation works and how we can move patients. We defer ventilation till absolutely the last moment. In fact, we're busy thinking about doing an advisory just on ventilation. So the mechanism of oxygenation we're much better at. Also the use of steroids. There's a very cheap steroid available in South Africa, which dramatically drops the mortality rate. And that's certainly, all my colleagues in ICU have said that that's made a huge difference. Before that, there are antiviral drugs, but honestly, their effect has been actually very, very modest. What we're seeing at the moment in South Africa, worryingly, is every GP, Tom, Dick, and Harry specialist is just grabbing whatever is off the shelf, treating some elderly person, and then they got better, and then ascribing this miraculous thing to their wondrous discovery. And it's really terrifying to watch. And we're very critical of it as the scientific collective, is saying, you guys need to follow the science. You need to do proper research. Otherwise, you might be hurting people. And we saw that with chloroquine, with politicians getting involved and idiot doctors who were really irresponsible about it. So the treatments, it's evolving at lightning speed. And I'm so proud of my research colleagues. That's not humble bragging, because I'm not involved with that stuff. But they have moved stuff forward, from vaccines, from treatments, to understandings of the pathophysiology at a rate of knots. In fact, it is really a testament to the scientific medical community, how they've all come together and they've just thrown their weight. I'm on the most bizarre conference calls with Iranians and Turkish and and Italians and Thai investigators, all with their wild ideas and which drugs, and so excited about doing stuff, but all just want to make the world a better place. They're not interested in fame and fortune, all the rest of it. And that's been really heartening side of this epidemic.
But one of the things, I suppose, from a point of view, I don't know if it's true for doctors, I suppose it is the kind of imponderables. A friend of mine who is the doctor at an old age home here, and they've had many of their elderly patients with all sorts of comorbidities have had the virus, and that other than one, they've all survived, put on oxygen, laid on their tummies, monitored properly, boom. And then you get people who are really very fit, and boom, I mean, is there a hell of a lot that we still don't understand about this virus?
So there is, and the beauty of it is there's so many smart people. I was reading an article the other day. It says almost a third of medical researchers are focusing at least partly on COVID. I know my work has forced me to to pivot and use all the HIV skills and the stuff that we can bring to bear to help on it. So there's a lot of smart people staring at it and trying to make sense of it. The initial wave of research, there was some really rubbish research that came through, and I think many people are aware of the chloroquine stuff and some of the other drugs, as well as some of the epidemiology was a bit suspect. But we're learning about this as we're going along, and there needs to be a certain level of humility as we've realized with this mutation. All of us were very smug about, I think everyone's heard about the spike protein. Unfortunately, that's where a lot of the mutations seem to be happening, and that's what a lot of our vaccines focus on. So the humility of understanding that this thing might change on a dime, and we're going to have to reassess. This mutation, I think, is a timely wake up on that. We're still not certain we have to worry, but we may have to pivot again very, very rapidly.
And when will we know? When will we know that the vaccines that they've developed and really some being used will be able to cope with the mutation?
Very quickly, because they're rolling it out in the UK, so we'll have breakthrough infections in no time if it's not working. And these, the UK and the US it makes me feel vaguely better about being in South Africa, because they are doing an absolutely shocking job in terms of capturing. I mean, the US, the number of deaths per million in the US is actually absolutely catastrophic to watch. I don't think anyone could cock things up as badly as they have, but they really have. And I think that's part of the reason why we found out the results from the vaccine study so quickly and so efficiently, is because there were so many infections happening in the US and the UK. So when you do, with HIV research, we go to where the HIV infections are to get the answer as quickly as humanly possible. Going to Sweden doesn't make much difference, but going to Durban, really is where the hotspot is. And the same way, this has allowed us to look at it. So we will have the data probably in the space of the next few weeks, actually. People will be able to tell us. Yeah.
Will that also tell us? Will that also tell us about issues about whether this is a more pernicious virus? It will.
Yes. Look, I think that that data already. I know that the people in Cape Town who put forward this who told us it was diabetics and older people, and that we looked very similar. That HIV patients actually weren't particularly prone to bad things happening, which was a huge surprise to a lot of us. But those Cape Townians did amazing work, and them and these people from UKZN are all involved in looking at this new strain, and they putting some of the people I've got tremendous respect for what you put enough smart brains in the room together. And the thing about South Africa is we have so much pandemic experience. We've been through HIV, we've been through TB, we went through bloody Listeria polonia like bacterium, and there are others as well. We've sent people off to Ebola land. We've had malaria. We've got so much expertise here that we've been very lucky.
Isn't that the frustration that we've got all this expertise? We should be in so much better position with regard to the vaccine than we are.
Absolutely. And we might be in a good position, but they're not communicating that to us. And it worries me when people like Glenda and Shabir seem to say our people we're talking to. I talk to some of the manufacturers and they say, we haven't spoken to the South African government. Maybe it was another department, but that worries me, is that we've got all this expertise. And everyone, no one here that I'm aware of, and any of the scientists have a political axe to grind. They want government to be successful. We're all invested in this thing together. We want them to be successful. And when they don't take advice, that's really, it's anxiety forming for us, and I think for everybody else.
So the take-home, there are many take-homes from this discussion, but one of them does seem to me that we really do need to ask government to tell us, play open cards with us, and where we are on this vaccine and what the plan is.
Yeah, like I said, we're allies in this if we need to be. Is if a manufacturer turns around and says we're going to try and make as much money off you as humanly possible, we know what to do. We did this with ARVs. We know what legal things to do. We know what activist things to do. We know how to shame people into handing over the stuff and to do the right thing. So it's a collaboration. That's they've got lots of allies, but they actually do need to tell us what they're up to.
Well, I suppose I do feel a bit more comforted that we've got people like you around. I have to be honest, but I'm afraid, Francois, I suspect I'm going to be talking to you yet again. This doesn't seem to be a short-term business at all, sadly.
I think we were so hoping it was going to just disappear and go away. So, including
Yeah.
me, I was just like, please, God, this has been a horror show of a year. Let's just close it
Hmm.
and pick up the pieces. Unfortunately, the worst of the last 2 months, I think the last 2 weeks actually has taught me is that probably this is going to be something that's going to be with us for years going forward.
Well, thank you very much, and we'll certainly get you back to explain that to us, but I'm very grateful. Thank you so much.
Thank you so much, Dennis, and to everybody out